Hello, so in this module of the course, we are going to discuss the Illumina 3D. That's a software from Boston Scientific that can give you the way to program the patients, a kind of artificial intelligence where the software, the tablet, will give you the solution on where you have to stimulate your patient. That's the idea. So they set the polarity, so the cathodes and the anodes, and then you're going only to increase the stimulation. It's amazing software. We still needed data to certify that this will help us better than the manual programming, but as I have many patients so far using Illumina 3D, and I am confident that's a really nice tool to help clinicians in program their patients. So it's really important. We discussed this in our course, and then start this first class explaining what's the hotspot or a hotspot in the STN. Actually, when you think about Illumina, they will say to you where you have to stimulate, but you have to say to Illumina where in the nucleus you want to stimulate. So for example, if you are programming patient with STN and DBS, I have to tell to the software where in the STN I want to stimulate. Otherwise, the software will try to stimulate all the nucleus, and as you know, we don't need to stimulate all the STN, we need the motor part of the STN. So the first part of the Illumina 3D setting is to say to the software exactly where I have to stimulate. This is what we say, that's it's similar to the hotspot of the nucleus. So I have to say to the software where I have to stimulate in the STN, the GPI, and the VIM, or whatever the nucleus I am stimulating. So in this class, we are going to discuss STN. In the next class, I'm going to teach you how you are going to get your program, the tablet of the Boston, and how you are going to cut, to slice the STN, to say to the software, I want to stimulate this part of the STN. And in the next class, we're going to discuss a little bit about anodic stimulation. And then I will move to real cases in my office. And then I think that the things will be really clear over the classes in this module, okay? So the first thing to know is the hotspot of the STN. So let's dive into this issue. And again, when we say Illumina 3D, is this software. Imagine that here you have the STN in green, as you can see here, and then you ask the software, where should I put my cathodes? And then the software will say, okay, you have to put here, 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 here. At the first glance, when you see this, it's a little bit confused, but again, over the next class, everything here will be clear for you because it makes sense. It makes sense. The positive, the negative contact, it all makes sense. Okay? So before I teach you how you're going to do that, we need to understand where I have to stimulate my patients in the STN. So let's move on to the hotspot in the STN. This is a paper published some years ago from Till Dembeck from Germany and his group, where they got the 4 main studies where the researchers they set out to discover where were the hotspot in the STN that elicit the best motor improvement, okay? So there are 4 papers, as you can see here, the yellow one, the blue, the red, and the green, where the researchers, they found that the hotspot to stimulate the STN was here. As you can see, this is the center of mass. So imagine that you pick up many VTAs, and then you decrease the threshold of this VTA to figure out where exactly is the center of mass in the STN where you have to stimulate in order to achieve the best motor outcome. That's the idea of center of mass. And then, as you can see, we are in the overall, in the posterior part of the STN. Here is anterior, posterior, medial, and lateral. So we are in the posterior part, and we are in the dorsal part. As you know, here is the ventral, and here the dorsal. So as you can see, we need to stimulate probably this region of the STN. If you do that, you are going to see the best motor outcomes. When you look at to the beta band, that we know that the beta, when you decrease the activity of the beta, you are going to improve the motor symptoms, especially the bradykinesia and the rigidity. And this is from DBS. I'm going to stop the video just to show you. Look at in this axial view, here is the peak of the beta band. So here is the hotspot, electrophysiological hotspot. Again, look in the previous slide where you saw the center of mass, and look at here the beta band peak. We are in the same region. Again, this is the hotspot of STN. If you slice the STN in three parts, this one, you are going to see that somehow in the transition between this 30 and this one, the posterior, you are going to find the hotspot in the STN. Overall, in this more posterior part, I'll improve more the tremor, and here in more medial part, more the bradykinesia, okay? But you are going to use one single electrode in each STN, so you can spread your stimulation over this region. If you go to another, this is a map from DBS where Theo Dembeck and his group, they got all the good responders. Imagine 100 of patients with Parkinson's disease and STN DBS. And then I get those patients with huge improvement. And then I get all the VTAs from these patients and build a map, a kind of map of the region where I have to stimulate in order to achieve a good motor outcome. And then when you look at here, and this is really important because I'm going to slice the STN like this. In the next class, you're going to see that. Here you have a 3D view of STN, and then I'm going to insert here this cluster of stimulations where you're going to see a good response. The first thing that you're going to see that outside the STN, maybe in the dorsal part, you can see some benefit. And you know this for, if you program patients in a routine, you're going to see that some patients, when you stimulate in the dorsal part of the STN, you can see some benefit. But the most important is that when you look at here, we are going to see this kind of area in the STN where you are going to probably see the most important motor benefit. And this is important because when you go to the tablet in the next class, you're going to see that I cut the STN in this way. I'm going to teach you. So again, this is a recent paper published in 2025 where, again, here they put all the main studies were to study the hotspot, and when you use electrophysiological hotspot, you are going to see this region So when I cut the STN, I'm going to teach you that I'm going to do something like this. And this will be the hot spot for me. It's not like this, it's this way. Because this ventral part, as you know, it can elicit some psychiatric effects and sometimes too much dyskinesia, and this anterior part is a bad region to stimulate because they're going to elicit some psychiatric symptoms. So my point here is that you have to know where you have to stimulate. And then you're going to tell the software, I want to stimulate this region, that's the hotspot. And then the software, they will do the best approach depending on the contact and are in more in the space where the contacts are in the space, and then they are going to say, okay, if you want to simulate this region, you have to put the contact here negative, this is anodic simulation, this is cathodic, and so far, and so on. So depending on the position of the electrode, they are going to say the best configuration in your electrode to elicit the best motor benefit. That's the idea of this TeamView and the Illumina 3D. So again, in this short class, you have to keep in mind where is the hotspot in the STN. As I just showed you the main papers. In the next class, I'm going to teach you how you are going to show this to the programmer. Okay, we are going to move to the tablet of the Boston Scientific. So if you have some questions, please let me know, and see you in the next class.